Greetings from City Hall. Today I join you to discuss the status of COVID-19 in our community. Back in March, our lives were abruptly interrupted by an unknown virus that quickly spread around the world. Our city, state, and nation were virtually shut down. Our children were denied the ability to have proper graduations. Grandparents and family members were left to communicate through iPads and laptops. And even our own Olympic champion was unable to pursue another gold medal this summer. But in true Hoosier fashion, our city and state have come together in response, following the recommendations of our health experts. Part of our Reopen task force is the Medical Advisory Group, which consists of doctors and health experts from Deaconess, Ascension St. Vincent, and the Vanderburgh County Health Department. These individuals have advised local government every step of the way during the pandemic, and like any doctor's orders, we've listened. There are many unknowns with COVID-19. In the beginning, the virus was devastating, especially to the elderly population, especially those with pre-existing conditions. However, those trends are changing, and now younger demographic is more dramatically affected. The good news is that vaccine trials are underway, and Operation Warp Speed by the federal government and world-renowned researchers has really good momentum. In the meantime, the number of cases has surged in our community. In the past 14 days, there have been over 400 new cases in Vanderburgh County alone. I'm not a doctor. Again, we're fortunate to have two tremendous hospitals and a health department with experts that truly have our community's best interest at heart. On July 2nd, Dr. James Porter from Deaconess, Dr. Heidi Dunaway from Ascension St. Vincent, and Dr. Spear from the Health Department met in my office to offer their latest assessment of the virus in our community. Dr. Porter explained that the positivity trend is going the wrong way among those being tested in Vanderburgh County. Dr. Spear, our county health officer, cited specific examples of age groups and gatherings contributing to the increase in cases. Contact tracing has been key in their efforts to identify potential carriers of this virus. At the time, we collectively implored the community to be vigilant and take steps to stop the spread of the virus. Many of you have participated in the Mask Up Hoosiers campaign and have listened to the message of personal responsibility that is preached weekly by Dr. Chris Box, our state health commissioner. Even so, our local trends cannot continue. None of us want to revert back to the really difficult restrictions that were put in place earlier this year. If you have been on social media or watched the news the past few days, the issue of wearing masks, and in some cases, it's all dominated public dialogue and in some cases been extremely divisive. In this era of type it, then walk away, many feel discouraged and angry. Let's be candid. We all have the same goal, and that is to stop the spread of the virus in our community. We want schools to reopen safely. We want businesses to reopen to full capacity and rebound from what has been a devastating business climate. To be clear, I fully support the continued reopening of our community. And we must learn to live with the virus and determine how we move forward as a community. Stagnation and further shutdowns are the last thing that anyone wants to consider at this point. That's why we need to get ahead of the virus. Last Friday, the top medical professionals from Deaconess and Ascension St. Vincent and the Health Department came together and unanimously recommended that we proceed with a mask directive to help slow the spread of the virus and to protect public health. Our school officials agree. I greatly appreciate the candid feedback from our school superintendents, David Smith of EVSC and Daryl Hagan from the diocese. I commend all of our teachers, administrators, parents, and students throughout the region who are preparing for the new school year. Getting ready to start the school year is always a challenge, but never more so than this year. I've consistently held that with all that government is doing, from testing to tracing to offering best practices on how to reopen, government should not also require citizens to do what we know is right. However, I've also said that the time may come with our numbers, the day-to-day data that we see that shows how the virus is spreading in our community. We may have to issue such a directive. Based on the growing numbers, the increased positive rate of those being tested, and on the advice of our medical advisory group, I am issuing a face mask directive that will take effect at 12:01 a.m. Wednesday, July 15th. State law provides that the order can be in place for 7 days and that the order can be renewed in 7-day increments. We'll monitor the situation closely and make renewals as long as the data and the expert advice dictate. So what does this mean? For many of us, it simply means continuing to wear a mask. Face coverings will be required in public settings, including public transportation and educational institutions. This mask directive is meant to be a simple and easy step for all of us to follow in order to keep our friends and families safe. At this time, we're not considering fines, and law enforcement will not be redirected from their duties unless there's a physical or public dispute. Let me put it another way. There won't be a mask police. Law enforcement will, however, respond to disorderly conduct or public nuisance calls as usual. It's my belief that our citizens will not let it get to that point. Being respectful to others by wearing a mask in public areas is the intent of this order. For example, if you go into a business or a store that's open to the public, wear a mask. If you're outdoors and you cannot maintain a 6-foot distance between other people, wear a mask. I know there will be plenty of questions, and we'll be posting an FAQ online with our order. We strongly support our county health department and law enforcement as they continue to enforce violations of capacity issues and as they pursue those who blatantly try to spread the virus. Our directive is similar to the governor's stay-at-home order earlier this year. We relied on our fellow citizens to do the right thing and exercise personal responsibility. From my perspective, the consequences of not slowing the spread are much greater than any action that the mayor may take. The punishment or penalty from the inaction of not wearing a mask won't be punitive. However, it will threaten the timely reopening of schools, endanger more lives, and keep us from moving forward in the fashion and at the speed we all want to proceed. I implore you to mask up, agree to disagree, and spread kindness and not the virus.